Right now I'm having chemo once a week, and about every few weeks I get a sedated lumbar puncture, which I did not have that luxury when I first had a lumbar puncture, so that wasn't fun. So I had a tumor in my chest. I named him Kevin.
So kids with cancer, they can have your classic mental health concerns that you would think of: depression, anxiety, behavioral concerns, just like any other kid, but they actually have a number of things going on that can make things a little tougher for them. So my name is Dr. Becky Dewey, and I'm a pediatric psychologist at Marybridge. So pediatric psychologists, we are child psychologists that specialize in seeing kids who have chronic medical concerns. One thing I can say is that it is oftentimes very much an honor to be able to work with kids and their families, because a lot of times, especially if you think about a scary medical diagnosis, it becomes this thing of just doing, right? We just get through, we're just surviving, and sometimes it can be a really helpful thing if you can have someone come in and slow things down a little bit and help you process through things. And it's a huge honor that kids offer to me and that their parents offer to me as well.
I believe social work is important for caring for the whole patient and whole family, because the patients and the families are not defined by the diagnosis. They are members of the community. The parents have jobs. They have other children, and the patients are, brothers and athletes and students. And so I think it's important to nurture that whole aspect of the patient and family and support them through their journey. I would like to say that people that give to Marybridge Children are making such an important impact on the lives of children and families. The patients and the families that I work with are so grateful for all the resources and support that we're able to offer on a daily basis, and it makes a huge difference.
I really think that the work that these people do with the kids and in pediatric medicine is just so valuable, and they are not only providing a medical service, but they're being emotional support. And if you have the means to donate to pediatric care, I think it's so valuable, because there's so much to be learned, and they get such a small piece of the funding from some of these other pots that I just really think that it's something that needs to be funded more. And I know that they rely heavily on donors to do a lot of that stuff, so it's really important. Jack is our youngest. He is 12 in 7th grade. Jack is funny and goofy and super intelligent.
He hasn't complained about anything. He'll let us know if he's tired or he's just not having a great day, but he hasn't complained about anything. He knows what he needs to do, and he's going along with it. And
we know that a positive attitude has a huge impact on success of anything: treatment, school, all of it. I do remember a couple of times where maybe I might have gotten misty-eyed, and he just would look at me and he'd go, "Mom, I got this. You don't have to be sad." And that's been his approach this whole time. I got this. I am most proud of his positive attitude and his grit.
I just give recognition to the entire Marybridge team, because they're always helpful.